Hello guys, welcome back to my channel HS Kingdom, and in this class I would like to take a topic on urinary system. And urinary system with the help of diagrammatic presentation already I have explained, and these topics are main intention is for nurses, and from the anatomy physiology for nurses. From the urinary system I am going to explain kidney, and it is very important question for GNMs and BScs. And GNMs it's a 10 marks question, and for BScs it is a 15 marks question. Draw the neat diagram of urinary system, write in detail about kidney. So that is the question I am going to discuss. So with the help of explanation, with the help of diagram, with the help of content, you try to gather the content, and this will be help you to pass. But if you want to get a high score, you need to refer standard textbooks like Tortora and other textbooks, Rose and Wilson, and you will get a highest score. So I think these videos will be definitely helpful for you. If you really like my videos and you are really interested in my videos, please do subscribe and share. So we'll go back to the topic. And urinary system in the diagram itself is, you can understand, urinary system consists of two kidneys. In the image you can see where I am showing two kidneys, and the transparent white color tube-like structures, we call it as ureters. These are two ureters and one urinary bladder and urethra. So these are the parts of the urinary system. This is for 2 marks question I am telling. Parts of the urinary system: two kidneys, two ureters. Ureters means the tube-like structures which are allowing for the passage of the urine from kidney to the urinary bladder. And the third part is urinary bladder, and fourth one is urethra. It's a opening where it allows the urine move from the urinary bladder to the external. This is the parts of urinary system. When we see the functions of the kidney, four functions are there. One is, in the kidney it acts as a filtration of the blood in the kidneys, whereas ureters, kidney has lot of functions that I will explain in detail later. So overall, if they ask for 2 marks questions, what are the functions of the urinary system? Kidney helps in the filtration of the blood, and ureters helps in the passage of the urine from the kidney to the urinary bladder. And urinary bladder is a structure, it's like a closed pouch like structure, which is called as a reservoir for the urine. It stores like a water tank for the reservoir of the urine. And fourth one is urethra. Urethra means it's an opening where it allows passage of the urine from the urinary bladder to the external source. So these are the, here I mentioned anatomy, parts of the urinary system, and I mentioned the functions of the urinary system also. Next we will see the next slide, where the kidneys are exactly located. So if you see the quadrants of the abdomen, upper quadrant, middle and lower quadrant, if you see where kidneys are located, see the image itself is showing, it's very clear. When I speak about the lungs, I said left lung is slightly slower than smaller than the right lung, we said. And here the same thing, here you can see the right kidney is slightly lower than the left kidney. Image itself is showing the right kidney is slightly lower than the left kidney, because here the largest and weightest organ of the liver is occupying, and it is pushing down the kidney little bit downward. So the kidney occupies the epigastric and hypochondric, lumbar and umbilical region. See, you can see the images. So epigastric, hypochondric, lumbar and umbilical region, total 4 areas it is occupying. This is the location of the kidney, and vertically they extend from the upper border of the 12th thoracic vertebra to the center of the body of 3rd lumbar vertebra. So it extends from the thoracic vertebra, 12th thoracic vertebra to lumbar vertebra 3. And the right kidney is slightly lower than the left, already explained, because the left kidney is little near to the median plane than the right, you can see. So that is what about location. And when you see the surfaces of the kidney, the external features, what are the external features you can see in the kidneys? Each kidney is a bean shaped. It is a bean shaped organ, and it has upper poles and lower poles, medial border and lateral border, and anterior and posterior. Everybody knows what are the external features means: superior border, inferior border, Then the kidney medial portion where it is attached to the blood vessels, that side is called medial border, and this side it is a lateral border. And upper pole is broad and in close contact with a corresponding suprarenal gland. You can see in the image here the upper portion or upper pole or superior pole of the kidney is attached with a suprarenal gland, or we call it as a adrenaline gland, and lower pole is pointed. The lower pole is pointed. So that is about surfaces of the kidney. So already I said location, then surfaces of the kidney, parts of the kidney I have discussed. Now we will see the lateral border is, what are the, already we said it is a bean shaped organ, and we said it is in brownish color, like need brownish color, color, and we see the kidney is important thing: superior border, inferior border, medial border, lateral border, and the front portion we call it as its anterior border, and back portion we call it as a posterior border. Now we'll see what are the measurements of the kidney. Measurements of the kidney is the total, the lateral border is this side, the convex. So if you see my hand, you can understand the, like this, if the kidney is located, this portion we call it as a medial portion, and that is called it as a lateral portion. So the medial portion, now here they are saying the lateral portion is convex, the lateral portion is convex, and medial portion is concave, and the middle part of the medial border depressed and is known as a hilus. So the medial portion of the area, it is depressed, that area we call it as a hilus. So this is about the what we can say, the borders, how the appearance is. The lateral border is in convex and medial border is in concave. Next we will see measurements. So what are the measurements are there? And when we speak about the measurements, the length of the kidney is 11 centimeters, the width of the kidney is 5 centimeters, and the thickness is 3 centimeters. This is the measurements. So just whatever I am speaking in the class, you write down that content. If you are writing also, you will definitely get the marks with the help of diagram. Okay, so just listen and write. That is that much assurance I can give you. So borders I have mentioned, then measurements, the length is 11 centimeters, then width is 5 centimeters, and thickness is 3 centimeters. So when we see the relations of the kidney, each kidney is occupied or related with one another, how it is there. If you take the left kidney, definitely left or right, both kidneys will be, upper pole is occupied or superior pole is occupied with the suprarenal gland or adrenal gland. Here one word answer I am explaining, suprarenal or adrenal gland. Suprarenal also call it as a adrenal gland. And the left kidney is attached to the spleen, then stomach, pancreas, left colic plexure, and colis of the small intestine. Colis of the small intestine. This is all the organs which are correlated with left kidney. And right kidney, if you see, in the right kidney also superior portion is with the suprarenal gland, liver, then duodenum. Here we said left colic plexure, here right colic plexure, and colis of small intestine. Colis of small intestine, it is related. So just imagine, if you take if your body, you just imagine the kidneys are both sides, mean if it is in the left side, it is related with left side organs, especially stomach, spleen, then the left colic plexure. Okay, and the superior portion suprarenal gland. Whereas right side, when we see here, duodenum will be there, and the upper portion is suprarenal gland or adrenal gland is occupied, and then next liver, duodenum, and right colic plexure, and small intestine. These are the relations you can see. Okay, then we will move to the internal structures or microscopic structure of the kidney. Please draw the diagram, write the content, whatever way I am explaining, definitely it will help you out to pass. So what is the microscopic structure of the kidney? So when we speak of microscopic structure, see the diagram. Outermost covering layer, we call it as a renal capsule. Outermost layer, we call it as a renal capsule, and innermost layer is called it as a we can see the space in between the pyramids, renal pyramids. The space is there, that space is called it as a renal medulla. And in between renal capsule and renal medulla, the space occupying place is called it as a renal cortex. Please listen carefully and write the exam as it is. Outermost covering layer is called as a renal capsule, and in between the renal pyramids, the space which is called as a renal medulla, and in between renal medulla and capsule, whatever the fibrous tissue is there, that's called as a renal cortex. And here, if you see, each kidney will have different pyramid shape organs, that we call it as a renal pyramids, and where the renal pyramids are attached with ureter structure, that's called it as a hilus, minor calyces or major calyx, we will say. So this calyx is directly connected to the renal pyramids with the help of papillae, and from the papillae it is divided as mm, major one, we call it as a major calyx, and the lower one, here the middle portion where hilus is there, that portion we call it as a major calyx, and the dividing portions we call it as a minor calyces, and this is called renal pelvis. Is it clear? So the renal pelvis continuation part only, ureters. This is about microscopic structure. So when we speak about microscopic structure, we need to remember renal capsule, renal medulla, then uh, renal cortex, renal pyramids, papillae, then it is directly connected to the renal pelvis. Then renal pelvis also again the connections are there. The major portion we call it as a major calyx, and the lower portion we call it as a minor calyx. So that is about microscopic structure of the kidney. This is for 15 marks. Please listen carefully, write the exam directly. And blood supply of the diagram. But the blood supply of the kidney, if you see, arterial supply is there, and renal arteries, which are the direct branches of abdominal aorta, are large in size. So from we can see renal artery and renal vein will be there. That's the arterial supply, renal artery and renal vein. Venous drainage from the renal veins, and it ends in the inferior vena cava. The left renal vein is longer than the right. Then when we see the nerve supply, for each organ nerve supply will be there. It's the sympathetic fibers derived from thoracic 10 and L1 segments. The sympathetic fibers derived from thoracic 10 and lumbar segments. And lymphatic drainage into, so lymphatic drainage means it is likely going to the lateral aortic nodes. So this is about blood supply. So in the blood supply you need to write arterial supply, venous supply, nerve supply, and lymphatic drainage. This is the content which is enough for 15 marks question. This is an anatomy question. Okay, so I didn't speak about physiology. I am speaking about only anatomy structures. Okay, then what is the clinical importance? Why you want to study about the kidney means? The kidney, when we work in the wards, most of the time we see some of the patients common reasons like urinary tract infections, URTI will say, urinary tract infections, UTI they will say. That's a very common infection, and there are a lot of critical complicated conditions are there. If kidney is not working properly, then that is called it as a we can see, so that is called it as kidney failure or renal failure. And renal failure, again it is divided into acute renal failure and chronic renal failure. Sometimes kidney may temporarily stop working, that's called it as acute renal failure. It may chances of getting back again, whereas there are some cases where because of the age or because of some poison or some complications of some other medical conditions, in that case where kidney will not come back to the normal position, that stage is called as a chronic renal failure. ARF, acute renal failure; CRF, chronic renal failure; UTI, urinary tract infections. Then there is a chances of getting infection to the bladder also. There is a cystitis, And so many times, even especially for children who has diaper usage and all, those people will have urethritis also. It's an infection to the urethra because of the external source, where prolonged time the diaper was held in that position, then it can lead to infections. So this is the clinical importance of kidney. So far we have discussed only about the kidney, and next topic I am going to take the continuation, very important question and several times asked question. That question I am going to discuss: functional unit of the kidney. Functional unit of the kidney. Kidney, we are saying kidney is doing this function, this function. Exactly in the kidney, which part is doing the function? That is called it as a nephron. So the next class I'm going to continue with nephron. Thank you for watching. If you really like my videos, please do subscribe and share. Thank you.